Hi everyone, welcome to the first day of the virtual workshop on Pan-Canadian Health Information Exchange Standards. My name is Linda Bird, and for those of you who don't know me, I'm an adjunct assistant professor here at the University of Victoria. I'm also an active health interoperability standards implementer and advocate, particularly in the areas of SNOMED CT and HL7 Fire. And I'm also the instructor of UVic's HIMP 537 course on Health Information Exchange Standards, or HIE standards, which is hosting this 3-day workshop series. So welcome everyone. Before we get started, let's begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt and Wasanich peoples whose historical relationships with the land continue to this day. Now, this is an annual event, and we have another exciting lineup for you this year. Today is the first day, as I said, of the 3-day virtual workshop on Pan-Canadian Health Information Exchange Standards. The workshop runs today, tomorrow, and Wednesday from 4 p.m. Pacific time. Now, for the first 2.5 hours, everyone is welcome to join us to listen to some of the great guest speakers from across Canada. And then around 6:30, we will say goodbye to most of you. And in the last hour and a half, I'll be taking the students of HIMP 537 through a range of hands-on activities to consolidate what we've learnt for that day. So I'll tell you a bit more about today's topics shortly. But before we get to that, let's take a quick look at the next few days. Tomorrow, we'll focus on Canada Health Infoway standards, including the Canadian Standards Release Centre, progress on the Pan-Canadian Patient Summary, and this year's Connectathon. And then on Wednesday, the topics will focus on HL7 Fire, including fire questionnaires and maps, and the Pan-Canadian Fire Standards. Please note that all of these sessions will be recorded and shared on the school's website. So if this webinar series interests you, or you've been thinking to yourself, how do I get to join those hands-on activities at the end of the program to gain a better understanding of these interoperability standards, you can enrol in the University of Victoria's Certificate in Health Terminology and Interoperability Standards. This is a 1-year part-time program with 4 graduate level courses done through weekly online evening classes, plus this virtual workshop. This is the only terminology standards program in Canada that is accredited with CIHI, the Canadian College of Health Information Management, to become a certified terminology standards specialist in Canada. If you'd like to join our September 2025 intake, please apply by June the 1st. And to find out more, you can either scan this QR code or visit our website at uvic.ca/HIMF and then click on certificates. So here's our agenda for today's workshop. There are 2 main focuses for today. The first is the standards from the Canadian Institute for Health Information, also known as CIHI, and the second focus is on social determinants of health and other disease risk factors. So let's get started. I am delighted to introduce our first speaker, Shannon O'Connor from CIHI, who will be presenting on CIHI Data Standards 101, A Path to Interoperability. Now, Shannon O'Connor is the Manager of Data Standards at the Canadian Institute of Health Information, or CIHI. She has over 15 years of experience in digital health, health data analytics, and data standards development. She is passionate about using data standards to advance interoperability and developing standards that contribute to a safe, equitable, and inclusive healthcare system for all Canadians. Shannon is a member of the HL7 Canada Council and a co-chair of Canada Health Infoway's Sex and Gender Working Group. Now, Shannon is currently running for a position on the Digital Health Canada's Board of Directors, and she would love your support. So if you're a Digital Health Canada member, you will receive a unique voting link between May the 5th and 16th. Shannon would love it if you could please take a look at her bio on the Digital Health Canada website and consider supporting her for this great opportunity. Now, we're proud of Shannon and would like to thank her for her wonderful contribution she makes to digital health in Canada. And now Shannon will tell you all about CIHI data standards and the role they play in the path to interoperability. Thank you so much, Shannon. Over to you.
Thank you so much for that lovely introduction. So I'm just going to share my screen. Bear with me for just one moment. Oops. So Jesse, or Dr. Bird, I can mainly see you. If you could just, one of you could give me a thumbs up, perfect.
Yes.
So thank you so much. It is truly my honor to be here tonight and to be kicking off this year's workshop. I think this is my third year participating in this workshop. And it's always such a wonderful combination of topics and speakers. So truly my honor to be here tonight and to help kick things off. So as Linda mentioned, my name is Shannon O'Connor. I'm the manager of data standards at CIHI. And today I'll be talking about CIHI Data Standards 101 and how data standards are the foundation for interoperability in Canada. So I'll begin with a land acknowledgement as well. So today we find ourselves connecting remotely from across the country. CIHI would like to collectively acknowledge the lands that we occupy, whether treaty or unceded. And I'm personally joining you today from Ottawa, which is the traditional unceded territory of the Algonquin and Anishinaabe people. The Algonquin Nation has lived on this land since time immemorial, and we honor their enduring presence, stewardship, and connection to this place. I wanted to share this photo of the Ottawa River. I'm actually in the CIHI Ottawa office this evening, and if you could see behind me outside the window, you would see the Ottawa River. And a little fun fact is that the Algonquin name for the Ottawa River is Kitchissippi, which translates to Great River or Big River. So we are grateful for this land this evening. So a quick outline of my presentation today. So I'll start off by talking a little bit about CIHI. I know most folks on the line are probably pretty familiar with CIHI. And then I'll go into our sort of Data Standards 101 presentation. I'll walk through the data standards life cycle that we follow at CIHI. I'll talk a little bit about data standards and interoperability, and this will really just be a little teaser for Christine's presentation, which will follow mine. I'll talk about the barriers to standardization and the way that we're overcoming these. And then I believe we're holding questions until the end of sort of the CIHI portion of the presentations, but we will have time for Q&A as well. So a little bit about the Canadian Institute for Health Information, or CIHI. So CIHI is an independent, not-for-profit organization that provides essential information on Canada's health systems. We were established in 1994, so actually last year we celebrated our 30th birthday. And we work really closely with federal, provincial, and territorial partners and stakeholders across Canada. So that's one thing that sort of is unique about CIHI, is our pan-Canadian nature, to gather, package, and disseminate information with the ultimate goal of informing things like policy, management, care, and research, ultimately leading to better and more equitable health outcomes for all Canadians. We are led by a 16-person board of directors with representation from across the country, and we're funded primarily by Health Canada and negotiated agreements with the provinces and territories as well. So this is just a quick snapshot of our mandate, vision, and values. So CIHI's mandate is to deliver comparable and actionable information to accelerate improvements in healthcare, health system performance, and population health across the continuum of care. And this mandate really demonstrates our commitment to our stakeholders and also helps ensure that we will respond to their needs rapidly with innovative tools and approaches. We have a number of values that guide our work. Inclusion, which is actually an updated value that broadens the intent behind our previous value of respect. Integrity, collaboration, excellence, and innovation. And then our vision is really better data, better decisions, healthier Canadians. So we have 3 strategic goals that sort of guide our strategic plan. We're about halfway through that strategic plan in 2025. I won't go into these in too much detail, but the first one, which is a comprehensive and integrated approach to Canada's health system data, the majority of what I'll be talking about tonight with regards to data standards sort of fits under that first strategic goal. So as part of that goal, we're really committed to collaborating with partners to continuously advance the creation, validation, and accessibility of health system data. Standards obviously being a fundamental component of that. Our other goals are an expanded offering of analytics, indicators, and tools to support health system decision-making, and health information users who are better equipped and enabled to do their jobs. So CIHI has a lot of data. We host extensive linkable pan-Canadian data across the healthcare continuum. So for types of care, we have data on things like hospital and emergency rooms, visits, mental health, long-term care, rehabilitation, pharmaceuticals. We have patient-reported data, we have health spending data, and we also have health workforce data. One of the really neat things about CIHI data is that a lot of it is linkable. So across our 28 data holdings, we have over 10 billion records, 3 terabytes of unique records, and a lot of that is linkable. So a good example of this is our population grouper, which links 8 CIHI databases across 3 provinces for over 23 million patients. So hopefully that sort of gives you a sense of the scope of data that we have at CIHI. And we get that data from a lot of different sources. So CIHI receives data from hospitals. So if you think about sort of our 2 most well-recognized data holdings are the DAD, the Discharge Abstract Database, and NACRS, which is our National Ambulatory Care Reporting System. This is hospital-based data. We also get data from regional health authorities, from residential facilities for our long-term care data, directly from clinicians in some cases, regulatory authorities and professional associations, provinces and territories, and other organizations. So our data sources really do span that continuum of care across the whole sort of healthcare ecosystem. So CIHI is evolving collaboratively, and one of the things that's very important to us is including the patient voice in our work. So we're really working hard to raise and bring the patient voice into more of our work, and we're committed to doing this in a way that's meaningful, purposeful, and authentic. We do this by involving families, patients, and people with lived experience, recognizing that patients offer a unique insight that helps us to understand our data. So the lived experiences of patients help to explain our findings and ensure that our work remains relevant to decision makers at all levels of healthcare. This is a little bit about the different ways that we engage with patients. So we do this through advisory groups, patient groups, and things like public consultations. Something that I won't be talking about too much today, but that I am working on is the development of pan-Canadian gender, sex, and sexual orientation standards. And that just this past fall, actually, CIHI was really lucky to partner with the Community-Based Research Center. We hosted a half-day forum where we brought in folks from the 2S LGBTQ+ community, and we were able to engage directly with community members on the development of these standards. So that's work that I'm really proud of, and something that I'm really committed to doing, not only for data standards development, but we're also committed to doing it across CIHI as well. Just a quote from Michael Decter about why it's so important to include patients in our work. So patients have a unique perspective that none of the other players can fully represent in an unbiased way. Patients have unique, legitimate interests in how services are designed and delivered. They have ideas and suggestions. Patients have a lot to say. All the players in the healthcare system need to hear the patient voice, not as represented by other players. I think that's a key point, but directly. For that to happen, patients need their own seat at the table and from time to time, their own megaphone. So I really like that quote, and I think it really represents why the patient voice is so important. Okay, so getting to sort of the meat of today's presentation, Data Standards 101. So I'll talk a little bit about data standards in general and our process of developing data standards at CIHI. So what are health data standards? So before we sort of dive in, I think it's really important to define health data standards. And I do think that data standards have the tendency to be one of those things that everybody sort of thinks they know what they are, but then when you ask people to define them, you sort of reveal fairly quickly that everybody has a slightly different understanding or a slightly different definition. So this is the way that we define health data standards at CIHI. Agreed upon and documented ways of defining health-related concepts and patient information. So health data standards are many things. They are computable, understandable, replicable, reusable, and interoperable. And they also contain things like technical specifications or other precise criteria designed to be used consistently as a rule, guideline, or definition. So I really like this definition because I think it's broad enough to encompass all of the things that we want to talk about when we're talking about health data standards, but it's also focused enough that we have a good sense that if everybody sort of shares this definition and understanding that we're all talking about the same thing. It's almost like standardizing the definition of data standards. So one really key thing about health data standards is that we need them across the healthcare system. So data standards are required for things like person health or clinical care, for care organization operations, for health system planning, as well as for population and public health. So implementation of health data standards produces information that can be used for all of these purposes. So by clients and families to engage in care planning, really important as people have sort of access to their own health information, by clinicians and care teams to inform and manage care provision, by organizations to inform things like quality initiatives, program planning, and resource allocation, as well as by the larger health system to inform resource allocation, benchmarking, and health outcomes by planners and policymakers. So if you think about CIHI, we've sort of traditionally sat in this third bucket of health system planning. That's kind of been our bread and butter. So we typically develop data standards with the goal of collecting data, analyzing that data, and then reporting it back to stakeholders across the healthcare system. But what we're really trying to do at CIHI is to shift our approach to data standards development and ensure that we're developing data standards that meet this wider range of health system needs. So still focusing on health system planning, but also developing data standards for things like clinical care. A really good example of this is the gender, sex, and sexual orientation standards that I just spoke about. So as we develop those standards, we're trying to ensure that they meet the needs for health system planning, but also for clinical care. So we're setting standards for things like personal pronouns and data elements that may never actually come to CIHI, but we know that there is a need within the larger healthcare system that we're trying to fill. So across those pillars that I just spoke about, standards enable stakeholders to do many things. So they have direct impacts, things like ensuring the quality of the data that we're collecting, enabling data linkage, improving comparability between different sources and over time, facilitating the design of data collection tools and reducing costs. And then they also lead to some concrete results. So solid data standards allow us to obtain comparable, multi-sectoral, disaggregated performance indicators, to create and adjust policy that is more tailored and effective, as well as to provide high quality and equitable care and improve patient experiences and outcomes. So all of those things really, the foundation to all of them is high quality data, which can be linked back to data standards. So what are the different types of health data standards? So when we talk about health data standards, there are many different types. So content standards is what I'll mostly be speaking about tonight, and which is where CIHI is focusing some of our work currently with the Pan-Canadian Health Data Content Framework. And we define these as data required to produce the information. So things like standards for clinical care and administrative data, things that you typically sort of think of as data elements, so like admission date, diagnosis, also for population data and demographic indicators, so things like sex and gender, for population health, for social determinants of health, and also for data quality. But there are also many other different types of health data standards as well. So code systems are structured terms or codes that represent related concepts, probably very familiar to many folks on the line, particularly those who are taking the course. So things like classification systems, reference terminologies, and value sets, examples of these being ICD-10-CA, CCI, and SNOMED-CTCA. We also have information standards. So this is the information that health systems require. So things like standards for indicators and methodologies. CIHI has a body of work called the Shared Health Priorities, where we do a lot of this work. Also CIHI's case mix grouping methodologies. And then we also have data exchange standards. So I saw some colleagues on the line from Canada Health InfoWay. Right now we're working really closely with our colleagues at Canada Health InfoWay on the connected care work that Christine will be talking about a little bit later on, and they are developing the data exchange standards. So I like to think about that as the how. So if you think about the content standards as the what, the data exchange standards are the how, and they really sort of dictate the requirements for how the data will flow. So I'm sure many of you have heard of HL7 FHIR. There are also other data exchange standards like DDI or SDMX, JSON, and XML. And then lastly, but certainly not least because they're so important, we also have privacy and security standards. So these are the requirements for privacy and data protection, things that protect the collection, use, and disclosure and retention of personal information and de-identified data. So I think Jessie will sort of be touching on some of that later on with her stewardship presentation as well. So as CIHI sort of builds up those data standards to satisfy those information needs across the healthcare system, it's important to note that we are absolutely not doing this alone. So we are working with many collaborators not only within Canada, but also internationally. Something that also always surprises me because it feels quite small, but the data standards space is actually surprisingly large, and there are many players involved. So CIHI plays a role in establishing data standards, and our role is broadening to support interoperability. We work really closely with Canada Health InfoWay, as I just mentioned, to enable that interoperability and sort of help design how the data will flow between systems. We also work really closely with a number of other partners that you see on the screen. So federal government partners, including Statistics Canada, Health Canada, the Public Health Agency of Canada, and others. With jurisdictions and regions, including our provincial and territorial partners, with a whole host of vendors and digital health partners sort of across that continuum of care as well. So HIS vendors within the hospital space, but also EMR vendors who are operating in the primary care space. We work with patients and communities, with international standards bodies, with researchers, as well as with regulatory bodies, associations, and clinicians as well. So you can see that there are many players involved. And I think that's just sort of a sign of how complex some of the issues are that we're trying to address. And I think it really does require input from individuals from all of these different areas. So I'll shift gears a little bit now and talk a little bit about CIHI's data standards lifecycle. So this is the process that we follow at CIHI when we develop our data standards. So it is a fairly rigorous process. It is documented. You can find it on our website. And this sort of dictates how we develop, implement, and maintain data standards. So I'll walk through each of these stages in a little bit more detail. So the first step is to sort of identify the system need, and we've included periodic evaluation here as well. So this step really involves determining new standards or modifications to existing standards that are needed to support emerging priority health system areas. A really good example of this was COVID-19. So when the pandemic hit, it became really clear that there were sort of some new system needs that we didn't have data standards for. So that would be sort of an example of a system need that emerged. We also include periodic evaluation here. So when we develop data standards, particularly for things I would say like race or race-based standard, also our GSSO standards, so gender, sex, and sexual orientation, we know that these spaces are always evolving, we're always learning more, and there are sort of new concepts and terminology that emerge as well. So it's really important that we periodically evaluate all of our standards for relevance. CIHI typically does this through something that we call a change cycle, where we look at our standards over a period of time and determine whether they need to sort of be updated or modernized. The second step is to develop and implement. So in collaboration with key partners and based on the input gathered through consultations, we develop and implement a standard with defined core data elements, value sets, and code systems. And these may vary based on the care setting. And then this is the standard that is sort of ultimately deemed ready for implementation. The third stage is to publish. So this is always the very exciting part when you can sort of release something that you've been working so hard on. So this is when the new or modified standard is published with supporting documentation. So that part is really key. Very rarely, if ever, do standards sort of exist on their own, but they usually do include things like user manuals, data dictionaries, and coding resources. So training guides, specific coding directions, frequently asked questions, infographics or data visualizations, and job aids. So if you think again about the Pan-Canadian gender, sex, and sexual orientation standards, we do have sort of the technical components of that standard. So that would be the data elements, definitions, and value sets. But we're also working on supplemental information that will sort of touch on things like safe data collection, governance, and storage of that data as well. So that's that kind of supporting documentation piece that is so important. And then last, but certainly not least, because this piece is extremely important as well, supporting the uptake of the standard. So provincial and territorial partners, other health-related organizations, and vendors receive ongoing support for the implementation of the standard in their systems and vendor solutions. So this includes things like tools to build capacity through training. We're actually working on this right now for the gender, sex, and sexual orientation standards as well, including data literacy, which is so important. And then also in some cases to troubleshoot data submissions and support for things like conformance testing as well. Then you can see sort of that arrow in the middle of the circle is that ongoing maintenance, because it really, the process is never finished. We sort of look to revise and revisit the standards as appropriate. And then sort of on the outside circle across this process is broad engagement and consultation across Canada. That process is also never finished. Christine will talk about this a little bit later, I think, in terms of the open review that we do for our Pan-Canadian Health Data Content Framework. But we know that that engagement and consultation is so crucial to ensure that we're developing and implementing standards that are sort of fit for use across the wider healthcare system. I got a little bit ahead of myself there, but basically those consultations can be with a whole host of stakeholders. So federal organizations, provinces and territories, clinicians, researchers, health delivery organizations, patients and Indigenous representation, and also those sort of Canadian and international standards groups. So it's almost like you go back and kind of start at the beginning to understand new information needs that may emerge, and then look at the ongoing maintenance of that standard as well. So data standards and interoperability. So once again, another word that I think many folks sort of talk about, but I think it's really important to define, is interoperability, or as we've sort of become more accustomed to talking about it at CIHI, you may also hear us say connected care. So really, at its most basic form, interoperability refers to the basic ability of systems and devices to exchange data and interpret that shared data. So that's really a twofold definition. It's not only about exchanging the data, it's also about interpreting the data. So for two systems to be truly interoperable, they must be able to exchange data and subsequently present that data so that it can be understood by a user. And you may hear that referred to as semantic interoperability. So making sure that the data sort of has the same meaning from sender to recipient. So one key thing that I really want to emphasize tonight is that there is no interoperability without standards. So clinical and administrative healthcare data standards establish the content and technical framework that enables healthcare providers to communicate and share information, once again, ensuring that that information sort of contains the same meaning from sender to recipient. So Pan-Canadian standards really support the safe and secure exchange of healthcare information across the continuum of care, clinical and operational decision support, data analytics, and population health management. If you think back to those 4 buckets that I sort of talked about later on, that's that scope of health information needs across the continuum of care. And health data standards are really a crucial part of interoperability, which once again is the ability for information to flow seamlessly between different health systems, workflows, and solutions. So what are some barriers to standardization? So there are currently a few different barriers to standardizing health data. So we're working really hard to kind of overcome some of these, but some of the barriers or challenges are things like jurisdictional readiness and funding models. So these really vary across the country. Funding is obviously not managed the same way across Canada. You've often heard, I'm sure it said that we have 14 plus healthcare systems across Canada. So therefore, when a new standard is released, business and clinical process changes may be required for a jurisdiction to adopt it. And then if that's the case, it's not only required within one jurisdiction, but it's sort of required across the country as well. Infrastructure, although I increasingly don't think that this is a barrier, but historically, I think the digital infrastructure to collect information may not be in place. So ongoing sort of investments in technology are required. This is one that is sort of near and dear to my heart, but something that we see a lot is that folks really sort of buy into the value of standards, but they've customized these standards. So an example of this could be like a jurisdiction specific standard that meets really specific information needs within one jurisdiction, but then not all of Canada is on the same standard. And then this is a big one as well, but traditionally lack of incentives for vendors to adopt and implement standards. So many folks on the line may be familiar with former Bill C-72, which was the Connected Care for Canadians Act, which was really a strong step forward for Canada in starting to legislate some of these things like adherence to data standards, for example. Unfortunately, that bill sort of died on order paper when Parliament was prorogued, but the spirit that was kind of introduced in sort of does live on, and the work is very much ongoing. So when there is a new government in place, which I guess will be tonight, if they do decide to sort of reintroduce Bill C-72 or something similar to it, we are really sort of working hard to develop that data standard foundation on which it could be based. So hoping for some progress with that as well. So I love this slide. This seems to be everybody's favorite slide. It's just sort of a little bit in jest, but standards are like toothbrushes. Everybody wants one, but nobody wants to use anybody else's. And I think that goes a long way towards indicating some of the challenges that we are facing right now. But I will say, I think we've made tremendous progress. There is a lot of buy-in. I won't go as far as to say that anybody wants to use anybody else's toothbrush, but I think more than ever, we're seeing really true collaboration across the healthcare system and across jurisdictions towards sort of one common set of data standards. So some ways that we're overcoming these barriers, the Pan-Canadian Interoperability Roadmap. So this was released by our friends at Canada Health Infoway a few years back now. And the work that we're doing that Christine will talk about shortly is sort of the first pillar of that Pan-Canadian Interoperability Roadmap. And that's the Pan-Canadian Health Data Content Framework and the Canadian Core Data for Interoperability. We're also working on interoperability governance, so advancing Pan-Canadian digital health and data interoperability, something that we're also working closely on with Canada Health Infoway. And then once again, the data content and exchange standards are a huge piece of that. So working to standardize the data as well as the way that it is exchanged between systems. So that's sort of the foundational layer. But then when you think through the implementation layer and what this will actually look like in practice, we also have data stewardship, which Jessie will be speaking about shortly, and the trust exchange framework. The idea of that being building trust through privacy, security, and legal frameworks. So making sure that we do have sort of those frameworks in place to enable the sharing of information. Also, our friends at Infoway are leading some work on a vendor activation program and vendor conformance, as well as sort of common procurement requirements. So there's a whole host of work going on towards sort of this ultimate goal of connected care for all Canadians. So that was a lot of information. I thought that I would try to the best of my ability to sum it all up, but I think it's really important that we sort of leave tonight with the knowledge that standards are the foundation for high-performing, patient-centered, connected health systems. Standards are really fundamental for interoperability and for data sharing. So for clinical information to flow with the patient across settings, for access by patients and care providers, and for things like data linkage and comparison across a wide variety of data sources. So that's once again thinking about supporting things like performance evaluation, research, innovation, and the delivery of better care. Once again, leading to that ultimate goal of improved health systems and better patient outcomes for all Canadians. And then the ability to share health information consistently and efficiently leads to a whole host of positive outcomes. So I think first and foremost, it improves safety and quality, as well as things like health equity. It strengthens care coordination and anticipates health system needs, increases efficiency and reduces cost, which I think is important in an overburdened healthcare system like we face today. It also reduces clinician burden, improving staff experience and ensuring that clinicians can focus less on paperwork and more on their patients. Also improving population and public health, enhancing the patient experience, and enabling and supporting best practices as well. So thank you so much for listening. I would love to connect. I am on LinkedIn. I'm always happy to chat with like-minded digital health, people who are as passionate about digital health as I am. So please do reach out and connect if you would like to. And as Dr. Bird mentioned, I am also running for the Digital Health Canada Board of Directors. So I'm super passionate about the future of digital health in Canada. And I feel like we're really on the cusp of sort of a transformative era in Canadian digital health. And I would really love the opportunity to contribute to this as a member of the Board of Directors of Digital Health Canada. So if you are a Digital Health Canada member, you will receive your voting link between May 5th and 16th. And I would absolutely love your support. Thank you so much.